handouts. Alright, so it will go here, alright, here on your posterior leg, okay, to supply the hamstrings. Alright, remember the sciatic nerve does not supply your gluteal muscles. Alright, the gluteal muscles are supplied, particularly your gluteus maximus is supplied by the inferior gluteal nerve, whereas the gluteus medius minimus is supplied by the superior gluteal nerve. Okay, so therefore, the gluteals will be intact. If you have sciatic nerve problem, gluteals will not be paralyzed. Do you understand, guys? Alright. Now, it goes down. It will supply the skin of the posterior thigh. Alright? This one, posterior cutaneous nerve of the thigh. Alright? And at the level of the popliteal fossa, it actually divides into two branches. One branch goes laterally as the common peroneal nerve. Okay, the common peroneal nerve goes anteriorly on the lateral aspect of the leg. It passes between the neck and head of the fibular. It passes between the fibular head and neck. And for that reason, if you have fracture of the fibular head or neck, or for example, you are wearing tight cast and the cast is up until here, or you're wearing a brace and that brace is too tight as well, there is a potential that the common peroneal nerve can be compressed in this area. Okay, and as we have discussed a while ago, the common peroneal nerve will branch into superficial and deep peroneal nerve. And then you have your tibial nerve. The tibial nerve passes from, or will continue from the popliteal fossa going down here. Okay, the tibial nerve, guys, has a cutaneous branch. And what is that cutaneous branch? The sural nerve. Sural nerve. Okay. Actually, I am not supposed to discuss this anymore because you're done with your anatomy. Okay. But just a review. Alright, I just have to tell you that this will be supplied. All of this, alright, posterior portion up until here will be supplied by your sural nerve. Okay, all posterior portion of the leg will be supplied by the sural nerve. The sural branch or the sural nerve is a branch of the tibial nerve. It is not a branch of the common peroneal nerve. It is a branch of the tibial nerve. Do you understand? So I'm going to evaluate from here up until here. Because if I evaluate above the popliteal fossa, then I'm no longer evaluating the sural nerve. I'm already evaluating the sciatic nerve. Do you understand, guys? Okay. Now, after supplying the hamstring muscles here, so what will I evaluate? The muscle that I will evaluate for MMP. Huh? Okay, hamstring, your knee flexors. Correct. If I want to evaluate these muscles, what shall I evaluate? Plantar flexors. Not only plantar flexors. I can evaluate my gastrocsoleus. I can evaluate my tibialis posterior, which is the strongest invertor of the foot. I can evaluate my flexor hallucis longus and flexor digitorum longus. There is no such thing as flexor digitorum profundus and flexor digitorum superficialis in the foot. Okay? This is a common mistake among students. They will be telling, okay, I evaluated the flexor digitorum profundus and flexor digitorum superficialis of the foot. Come on. It's only found in the upper limb. Okay. And even the extensor digitorum longus here doesn't have a brevis component. Do you understand what I mean? But the extensor digitorum longus here in the anterior portion of the foot has a brevis component, extensor digitorum brevis. In fact, that is the only muscle located at the dorsum of the foot. Okay. Now, going back. So, gastrocsoleus, plantar flexors. Flexor hallucis longus, big toe, flexion. Okay? Flexor digitorum longus, toe, flexion. Tibialis posterior, inversion. Do you understand what I mean, guys? So those are the muscles that we need to evaluate. Okay, now, the tibialis anterior, the tibial nerve, alright guys, after entering, or right after, it enters your fibrous bands here. There's a fibrous band here. We call it the flexor retinaculum of the ankle. So if you have flexor retinaculum here, extensor retinaculum here, you also have extensor retinaculum here and flexor retinaculum here. Do you understand? So after passing through the flexor retinaculum, just behind, immediately behind the medial malleolus, it will divide into two branches. What are those two branches? The lateral and medial plantar nerve. Okay, now, okay, just imagine this is my foot. Okay, this is the plantar aspect of the foot. First, second, third, all are supplied up until the heel from here, okay, will all be supplied by the medial plantar nerve. Understood? The fourth and the fifth toes and all the lateral border of the foot will be supplied by the lateral plantar nerve. Do you understand? Okay, so if I'm evaluating here, okay, sharp or blonde? Blonde. Sharp or blonde? Sharp. Okay, up until here, okay, up until my, okay, my third toe, okay, I am actually evaluating my medial plantar nerve. And then the fourth and the fifth toe, I'm evaluating my lateral plantar nerve. Now, what are the muscles that are supplied by the lateral and medial plantar nerve? It is already stated in your handouts. Okay. Okay. So, the lateral plantar nerve, okay, or the medial plantar nerve, guys, is medial abductor hallucis, okay, flexor digitorum brevis, flexor hallucis brevis, okay, those are the three muscles. Okay? Abductor hallucis, flexor digitorum brevis, and flexor hallucis brevis. Then all other muscles will be supplied by the lateral plantar nerve, like your interossei. Okay? The interossei, okay? The abductor digiti minimi, okay? The adductor hallucis, the abductor digiti minimi, all right? Flexor digiti quinti, okay, are all supplied by the, what? Are all supplied by the lateral plantar nerve. Do you understand? Why do you have to take note of that? If there is no paralysis of these muscles, okay, gastrocsoleus, intact. Tibialis posterior, intact. Flexor hallucis brevis, weak. Sorry. Big toe flexion, a little bit weak. Okay? Toe flexion, a little bit weak. Alright. What am I going to suspect? The damage to the tibial nerve is not located at the leg. It is located here. It can be due to tarsal tunnel syndrome. Okay, how will I confirm? I'm going to evaluate the sensation. If the sensation of the entire leg, entire sole of the foot is absent, and there is paralysis of the interossei, of the flexor digitorum brevis, flexor hallucis brevis, abductor hallucis, okay, abductor digiti minimi, okay, all of these small muscles of the foot are all paralyzed, then I can confirm that it is due to tarsal tunnel syndrome. Okay, it means that my tibial nerve is damaged here. So how am I going to test it? I'm going to perform Tinel sign at the, what? Tinel sign at the ankle. That's it. Now, please review all the manifestations depending on which syndrome you are talking about. If the lateral femoral cutaneous nerve is damaged, what will be the manifestation? There will be pain and dysesthesias on the anterolateral thigh. Okay, no motor abnormality. What do we call that condition? Meralgia paresthetica. Okay? If the obturator nerve, for example, guys, is damaged, alright, obturator nerve is damaged, usually it happens in those patients with history of giving birth or undergoing surgery involving the pelvis or the perineum. Alright, so you have to correlate it with history. And what would be the affected part of the body? There will be loss of sensation on the medial aspect of the leg. There will be paralysis of the adductor muscles, obturator nerve palsy. Okay, you understand? Femoral nerve, which muscle shall you check? You need to check your quadriceps, and your hip flexors. Alright. Which skin shall you check? Anteromedial thigh and then anteromedial leg because the anteromedial leg is here. Okay, to be safe, do your evaluation starting from the medial malleolus going upwards. Okay, for the saphenous nerve. Do you understand? If I'm suspecting a common peroneal nerve injury, okay, so what shall I do? I will have to check both my superficial and the peroneal nerve because both of which are branches of my common peroneal nerve. Okay, if the entire common peroneal nerve is damaged, okay, the main branch is damaged, then there will be paralysis of all the muscles located at the anterolateral compartment of the leg. So there will be paralysis of peroneus longus, peroneus brevis, peroneus tertius, tibialis anterior, extensor hallucis longus, extensor digitorum longus, and extensor digitorum brevis. All of these muscles will be paralyzed. Understood? Okay. Understood? And there will be loss of sensation on the anterolateral leg and dorsum of the foot. Okay. If I'm suspecting a common peroneal nerve damage. If I'm suspecting a sciatic nerve injury, there will be loss of sensation on the posterior aspect of the thigh, posterior aspect of the leg, and the sole of the foot. If I'm talking about the main branch of the sciatic nerve. Do you understand, guys? Do you get it? Alright. So, all of this will be lost. There will be loss of sensation on the posterior aspect of the thigh, leg, and sole of the foot, or the plantar aspect of the foot, if the sciatic nerve is damaged. Okay, paralysis of the hamstring, paralysis of the muscles of the calf, and paralysis on the muscles located at the sole of the foot. Everything there will be paralyzed because all of which are being supplied by the sciatic nerve. Correct? So as the damage goes down, definitely there will be less and less damaged. Actually, not only the sole of the foot. If the sciatic nerve is impinged, alright, not only this, but also the anterior compartment. Muscles at the anterior compartment will be paralyzed because of your common peroneal nerve. Common peroneal nerve is a branch of the sciatic nerve. Alright,
So,
get it? However,
everything else is
however, this one, correct.
It's better to have a lower injury.
However, this one, these muscles will not be paralyzed. Okay, gluteal muscles because they are supplied by different nerve. Gluteus max supplied by the inferior gluteal nerve. Okay, how are we going to check that? If it is paralyzed, we do hip extension. Alright, for our gluteus medius and minimus, which movement shall we check? Abduction. Correct, because they are hip abductors. They are supplied by the superior gluteal nerve. Superior gluteal nerve. Okay. And definitely, guys, there will be no sensory abnormality if these nerves are damaged. Is that clear? Okay. Then do your review.